here in Newcastle at NOAH's for an allied health conference, which is the first of its kind for us. The theme of the event is We Care Together, and part of what we're trying to do is build our engagement and connection with allied health and support allied health practitioners and services to come together and work together as well.
Allied health professions are relatively small in the scheme of things in Australia, but as a collective, we're about 150,000 people, so that's an opportunity for us to stand up and be heard in sort of the broader scope of things.
Just acknowledging we're a diverse group of people, allied health practitioners, and don't often get the opportunity. What the PHN is providing is this opportunity to bring all allied health practitioners together to actually look at what others are doing and celebrating some of the innovation in allied healthcare and enable allied health practitioners to share that information.
Networking today has been fabulous, learning who else is out there to provide services and the different ways that people provide services, which is really beneficial to lots of patients.
I think today's conference has been a great start to bringing us all together, voicing those issues and concerns, and perhaps finding a way to be able to work together.
The primary health network is really taking on board allied health needs and issues, and it's great to have something like this today because we're all together and we chat and we learn from each other. High quality of talks as well, and some research coming through. And this is really about allied health. This is what we like, this is what we need.
Watching it come to fruition today has just been really exciting, and to see it so well supported in its first year and being offered in the key locations of Tamworth and on the Central Coast as well. So there's a greater reach of people being able to attend. So I think that's absolutely amazing.
Part of what we've found over the past couple of years, particularly during the pandemic, is that we've really had to build our engagement with allied health. We've done that through an allied health education program, through telehealth and digital health support, through PPE distribution, through building in more health pathways that relate to allied health, amongst a range of other activities. And that's been a really interesting platform for us during the pandemic to work out, okay, where are we now and what does the future look like? And we're looking forward to continuing to develop that.
And I think we're at the forefront at the Hull and New England Central Coast PHN because we were the first to engage an allied health reference group to represent broadly allied health. That's now a national body that's engaging and advocating for allied health services, so we're helping and improving health in our communities.
The PHN does an awful lot for allied health, and their focus is connecting and working more closely with the allied health community.
The first probably contact I had with them was with the PPE, coming to the practice and giving us some masks when there was no masks around. So that was really lovely to feel that connection and support with PHN then.
The PHN provides allied health practitioners with advocacy, both at a sort of local and national level. They've provided us with support for our practice with things like digital health, with counselling, with grants and access to some and support at the end of the phone.
I think the PHN is benefiting allied health by giving them opportunity to advocate for their professions, to collaborate together, and then fixing gaps in health service delivery in different communities, and doing that in a way that's responsive to the needs of people actually living in those communities.
The PHN is at the forefront of supporting and assisting allied health practitioners engage in digital healthcare practice, and that's not just about telehealth, that's through the design, the implementation and monitoring the care that we provide. So we're going to have greater insights and more objective information to guide our practice into the future so we can improve the health of our communities.
The main benefits that I think the PHN offers from a personal perspective is obviously the offer of support through counselling services if required, which has been traditionally a GP thing. Now it's sort of branched into allied health, which is really important. From a more professional level, it obviously gives business development a little bit of a boost up.
Having the opportunity to do some of their webinars and their online learning, and as a business I've found it really supportive actually. There's been some fantastic sort of webinars and resources that we've been able to tap into because of the PHN.
And I guess more broadly outside of that, from a physio perspective in general, it's about advocacy for health literacy, really. It's trying to encourage that people can go and see a physio from there, can leave their door and come to our door. They don't need to see a doctor to do that, which is a common question we get asked. So just trying to encourage people to know a little bit more about their health.
I think it's a difficult job to try and liaise across all of primary healthcare across an area as big as ours, and so I've watched on with optimism and enthusiasm for what the PHN can do, and I'm really proud to be a part of some parts of what the PHN is doing now.
This PHN does a really great job, and I encourage you all to get behind the PHN and work with the PHN. There's lots of education, lots of training, it's free. Attend, participate, join, let your voice be heard.
Your ally in health.
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 Your ally in health.